We're going to go on and get started this morning. As people continue to join us, we will catch them up with where we are. Good morning. I am Joselle Luster Booker, President and CEO here at the MMBC Continuum. We are very happy this morning to kick off the first installment of our MBDA CARES initiative. The MMBC Continuum is a full-service minority economic development agency here in Memphis, and we connect scalable minority and women-owned businesses to B2B opportunities with major corporations. And so in response to the unprecedented COVID-19 pandemic, MBDA CARES, which is operated by the MMBC Continuum, launched MBDA CARES to provide resources, services, information, training, and education to small businesses and minority businesses that have been impacted by the effect of the COVID-19 pandemic. And so as we transition our day-to-day operations back to the workforce, one of the key concerns keeping your employees and customers safe during this pandemic is exactly and precisely how to do that. So today you will gain insight and also learn best practices from a local medical expert. And we're so happy to partner with this organization to bring this information to you today. But before we begin with today's speaker, I want to introduce you all to the MBDA CARES Program Project Manager, Brittany Elkins. Brittany?
Good morning, all, and welcome to today's MBDA CARES webinar. I am Brittany Elkins, Program Manager of the MBDA CARES initiative. COVID-19 has dramatically affected countless minority and small businesses and their employees and their families. Seeking relief and working towards recovery can be a feat for business owners who are working tirelessly to keep their doors open. The MBDA CARES initiative, a program funded by the Minority Business Development Agency and powered by the MMBC Continuum, was launched in response to this unpredictable impact of COVID-19 on minority and small businesses. We are committed to providing free COVID-19 related support through educating, training, and advising business owners and their employees here in Memphis and across the Mid-South, including the states of Tennessee, Arkansas, and Mississippi. Today, we are hosting the first of many webinars that have been designed to connect you with experts that will give you insight and best practices that you can implement into your day-to-day operations. Today's webinar, I pose the question: is your workplace vulnerable to COVID-19 and other communicable diseases? For many minority and small businesses, COVID-19 is a never-ending threat to the health and safety of their employees, customers, and their families. I'm sure one of your top concerns is preventing the spread of COVID-19 and other communicable diseases in the workplace. Unfortunately, a business that lacks knowledge, policies, and procedures to reduce the transmissions of airborne viruses put themselves at great risk of loss of employees, loss of business, and ultimately loss of revenue. During this hour-long webinar, you will gain insight and learn best practices on how to protect yourself and your employees in the workplace from the coronavirus and other similar diseases. Today, I'm joined by Dr. Jake Lancaster, Chief Medical Information Officer of Baptist Memorial Healthcare. Dr. Lancaster works to improve the effectiveness and usability of healthcare technology for physicians and providers. He also continues to practice as a part-time internist for Baptist Medical Group. He's passionate about bringing a stronger emphasis on data to the healthcare industry and using information to improve processes and the quality of care. Welcome, Dr. Lancaster. Thank you for joining us today.
Thank you, Brittany. It's great to be here or be where I am. I wish I was with all of you in person. Unfortunately, as we all know, we can't do that. Over the last 6 months, we've had to make a lot of adjustments, and so getting very used to some of these Zoom calls. But it's very hard to judge the reaction of the audience when I'm doing some of these. So if my jokes fall flat, bear with me. But yes, I'm Jake Lancaster. I'm an internal medicine physician. I am the Chief Medical Information Officer for Baptist. I've been there for about a year now. And I continue to practice as an internal medicine physician, both at Baptist Memphis Hospital, Baptist East, as well as on the outpatient side at the Humphreys Clinic. So I'm seeing both the patients on the inpatient and the outpatient side that come in with COVID-19. I've also kind of led our initiative of reviewing our data and trends related to COVID-19 over the past 6 months. And hopefully I'll be able to share some of those with you today, and worked closely with our HR team when we were going through our own processes for what we were going to do with our employees and how to keep them safe. So I'll be able to share some of those insights with you today.
Wonderful. So as I mentioned earlier, the big question today is how can business owners protect their employees during this pandemic? But before we discuss that, let's first begin with the general question. Dr. Lancaster, can you explain to us what exactly is COVID-19?
Yes, so people are probably very familiar with it over the last 6 months, but the best way I've had it explained to a layperson is it is a cold virus that thinks it's the flu. So everybody's had a cold in their lifetime. Some have probably had them multiple times a year. It is actually in the same family as the majority of those cold viruses. So what usually will just affect your nose and your throat, cause some sneezing and coughing, has spread from that upper respiratory tract down into your lungs. There are several other epidemics that you may have heard of that are very similar to this virus, but did not quite achieve the pandemic status as it. So, MERS and SARS, you may have heard of, especially SARS early on in the 2000s. It was a big scare, and there's multiple cases around the world, but never really achieved that global presence that COVID-19 has. And so those are all very similar. So you got your common cold, and you have those other outbreaks like MERS and SARS. But this one is a bit different just because of the way it is able to spread from those asymptomatic individuals. Is part of the reason it has become this great pandemic is because with those other outbreaks, with those other diseases, most of the patients that had it were symptomatic early on. Whereas with this one, you can be completely asymptomatic walking around, but still spreading it. And that is one of the reasons it has become so devastating to us. And that's kind of the basics of what the actual virus is. It can obviously get a lot more complicated, but the symptoms and what organs it targets, I believe, is one of the next questions you were going to ask. But it really can produce a wide range of symptoms, and that's based on the organs that it's able to target. So common symptoms that people will get are fever. So about 83 to 99% of patients that come down with COVID-19 will get a fever. The problem is it's not necessarily the first symptom that you'll get. So actually at our hospital, the patients that come to the emergency department that end up getting admitted with COVID-19, only about a quarter of them have a fever when they come into the hospital. But over the course of their stay, over the course of their illness, it does get up into the 80% range. Another one that is very common is cough and shortness of breath. So shortness of breath is the most common sign and symptom that we see coming into the emergency department. About half of the patients that come in with COVID have that as their chief complaint. And cough being very high as well. About 25% of those will have a cough. COVID-19, as you may have heard, also affects the GI tract and can affect your nose. So a large number of patients, one of the first symptoms they'll have, especially those with milder cases, is just loss of smell. So you can see about 15 to 30% of patients will have that. And that actually, once they recover, a portion of them won't even have that sense come back, and a portion will have it come back, but it'll be slightly lessened than usual. But that is definitely something. If you wake up and all of a sudden you're unable to smell your cup of coffee or your breakfast, that may be a sign that you have COVID-19. Nausea, loss of appetite, and some diarrhea is another big one that was identified early on. Some of those patients that'll be the first thing they get, because COVID-19 can attack the GI tract. So we see a good bit of patients that their first sign and symptom is diarrhea. You see on here the picture of the brain. So confusion and altered mental status, especially in the elderly population, is something we've seen quite frequently. About 7% of the patients that we treat come to the emergency department just for altered mental status confusion. So new onset confusion in your mom or dad or the elderly is something that we look out for, as well as just generalized weakness. So you had a lot of energy the day before, and all of a sudden now not quite as much energy is something that could be indicative of COVID-19. Those are some of the organs that it's targeted that will produce some of those signs and symptoms that you may have. COVID-19 can affect almost any organ in the body, though. So once you have it, especially in our severe cases, it can target the heart. We have a lot of patients that will develop this inflammation in the heart related to COVID-19. And it can cause clotting in the blood vessels. So we've had patients with strokes and had patients with blood clots related to COVID-19. Unfortunately, and even seen that in some of the younger population in their 30s. It can affect the liver, cause some slight inflammation in your liver, as well as some kidney disease as well. So there's really very few organs that are not a potential target of COVID-19, but certainly the most common ones are the ones that are the respiratory tract. So your upper respiratory tract, your nose, your mouth, and your lungs, especially for those milder cases.
Got it. Thank you. So what are some of the recent stats and trends of COVID-19 today?
Yes, and if you want to go to the next slide, I can take you through some of the publicly reported data as well as some of our internal data. So this is a graph that I take from the New York Times. This is something I look at on a daily basis, and I show to our executive team multiple times a week. These are all the top graph is newly reported cases in Tennessee, starting since March and going through the end of August. And as you can see, it looks to be that Tennessee had its early peak in late July, and that we have been consistently on a downward swing over the past several days. So that is good news for the number of new cases in Tennessee. As you'll see in a minute, it's not evenly distributed throughout Tennessee, and unfortunately West Tennessee is still kind of in the throes of it right now. But that is good news to see that cases are finally declining after 4 or 5 months of steadily increasing, especially late July. If you look at the bottom graph, those are new deaths by day in Tennessee. Those have continued to go up despite the number of new cases going down. And some of the reason for this is just that patients tend to get sicker later after they get infected with COVID-19. So deaths tend to lag by about 3 weeks to a month. So if you're a patient that gets a case of COVID-19, you can be in the hospital for over a month and still not make it. And so that's kind of why the deaths show up much later. Also, one of the things we see is that patients will get diagnosed with COVID-19 and they'll be fine. They'll be able to stay at home. And then about a week later, the immune system takes over and patients get a strange immune reaction to COVID-19, which is causing some of those more severe cases that cause you to be hospitalized. So that's the reason why the deaths are always a little bit delayed from the number of new cases, but hopefully over the next several weeks, we'll start seeing that decline. If you want to go to the next slide. Here's the map that I also look at on a daily basis. This is again from the New York Times, and they did this for every state. You can see Memphis at the bottom left, and you can see that the darker areas represent where cases are highest over the last 2 weeks. So you can see the West Tennessee area around Jackson especially has had a higher number of cases over the last couple of weeks, whereas East Tennessee is faring a little bit better. This, of course, doesn't show many of the surrounding counties of Memphis that are in Arkansas and Mississippi, but I can tell you that they also have had a little bit better over the last couple of weeks. So things are starting to look a little good for the Memphis metro area, but still not quite where we want it to be. Let's go to the next one. And this is Baptist's internal data looking specifically at the metro area. And the blue bars represent our just general medical beds, whereas the orange bars are the ICU beds. And you can see since early July, we had a steady increase in the number of cases, peaking in the early August. And then we've, over the last 10 or more days, have had a steady decline. And that's mostly been in our general medical beds. The ICU beds have remained in the 30s and 40s. And we think this is the case because the average age of our population has gone up a little bit for those admitted with COVID-19. There was a period of time in July where we were seeing a much younger population of patients admitted with COVID-19. You may have heard of all the college students, those in the 20s and 30s that were getting COVID. And we believe now that it's probably spread from that group to the parents and grandparents, and that's the reason we're seeing it. The higher ICU, but less cases right now. So go to the next slide. And this is the same data. So before we were looking at inpatient cases, patients admitted to the hospital. Now we're looking at outpatient. And again, we see that nice trend of cases kind of peaking at the end of July and declining towards the end of August. So hopefully we'll continue to see that trend. But again, there's a lot of unknowns with our case counts and things of that nature right now because of schools reopening and other factors that we can't account for. So, but nice to see a little bit of a break, at least for a short period of time, and hopefully that'll continue.
Thank you. I want to be sure to mention that we're going to hold a Q&A at the end of this event. So if you have any questions, be sure to drop it into the Q&A box. We'll try to get to them towards the end. So Dr. Lancaster, we're going to switch gears and go over to the workplace. Sure. What is the risk of contracting COVID-19 in the workplace?
Yes, and if you go a couple more slides in, I will show this graph from an article in the New England Journal of Medicine. This one right here. Good. And so on the left-hand side, that y-axis shows your risk of contracting COVID-19 in the workplace, depending on the type of work that you do. And the x-axis up top is the risk of death based on your own personal characteristics. So if we start at the bottom left, those that are working from home or in places that have this really strict physical distancing, you're at the lowest risk of getting COVID-19. So if you're a remote worker, just logging in from home, obviously that's very, very low risk for getting it, especially if you're not interacting with anybody. Move up one, so that medium group of risk, this is probably where the majority of people on the call are going to fall. This is where the majority of work happens. So you're in contact with people with an uncertain COVID-19 status. You may be working in retail, you may be working in a restaurant, and you have customers come in that you don't know if they're positive or negative. And then the ones that are at most risk are those that work in healthcare or work with patients that have known COVID-19. So those are at the highest risk of catching it. And then, how do you assess your risk of a bad outcome based on it? Well, it depends on your personal characteristics. So if you're younger age without a high risk condition, like cancer or being immunocompromised, then no matter which one of those occupational risks, you're still at pretty low risk of death. Now, if you move further right on the spectrum, if you're middle age or you have a high risk condition, then you would be that B at the top in the middle. And then obviously if you're older age with a high risk condition, really your level, especially if you're working in healthcare or working with patients with known COVID-19, have a much higher risk. And so that gets to some mitigation strategies that you can look at the bottom for A, B, and C, what to do. And so we'll talk about this in a little bit more detail later, but if you fall into that B or C category, this is going to be a good time to kind of discuss your risk with your employer, discuss the risk with the employee if they're able to identify, and really try to mitigate any exposure, and making sure that all the proper gear is being worn, and which we'll go into. But if you're in that really high risk group, that C group, you really need to be, considering, stopping work or considering alternative means. If you're falling into that older age with high risk condition and you're working directly with patients with known COVID-19. So that may be a case where you try to find them something else with less exposure.
Thank you. What can business owners do to slow the transmission of communicable diseases of COVID-19 in the workplace?
Yes, let's go to the next slide. So OSHA, if you have not been to their website, they have a topic specific to COVID-19. There's several other government agencies that also have some recommendations on what to do for COVID-19, including the CDC. So both of those would be great resources to take a look at when you're trying to prepare your workforce for COVID-19. But one of the first things that both of them recommend is developing an infectious disease preparedness and response plan. And they do have some outlines of what you would want that to look like. And so this is everything from how to prepare your workplace for reopening to what to do if an employee gets sick, or what to do if a patient comes in with suspected COVID-19, how to respond based on those various scenarios. But some of the most basic things that we've all been hearing about for the last 6 months are promote frequent hand washing of your employees, post those signs if you don't have them in the bathroom, and they say the CDC, recommends that you wash your hands for 20 seconds, which is a long time with soap and water. And, so one of the things we recommend is telling them to sing the happy birthday song while they're washing their hands, because that's about the appropriate length. And it's a surprisingly long period of time. One of the other things that they recommend, and this is hard to do, is encourage workers to stay home if they're sick. Many workers would previously come in, even in the healthcare industry, if they had a mild cough or cold. So this is a big change for a lot of workers, is even if they're just having mild runny nose, mild sore throat, and would normally be able to continue working, encourage them to stay home, because that could certainly be an indication that they have COVID-19. And if they do, they can potentially telecommute or work from home, work remotely until they're sure that they don't have COVID-19. Some of the other things that you would want to explore are opportunities for telecommuting and staggering shifts. So maybe not having everybody in at the same time, but staggering those shifts over time. So some businesses are working where they're having, employees come in for 3 or 4 days a week, and then the other half of the employees coming in for that Wednesday through Sunday or Wednesday through Saturday the rest of the time, and not having them on at the same shift time, just to discourage the number of employees in the building at the exact same time. And the same goes for reducing capacity. So a lot of them will post limits to the number of customers they'll allow in at the same time. I've seen some that require you to take a number and stand outside, and then only be allowed in after a certain number of visitors have left. One of the other things, of course, is universal masking, which is, obviously the law in Memphis, where customers coming into the business. But we have seen and heard that even if a patient has a mask on and the employee has a mask on, and one or both of them actually have COVID-19, there is still a good chance that they will not pass it on to the person that they were in contact with. So it really does help prevent that spread. So that universal masking, getting your employees comfortable with wearing that at the appropriate time. Discourage the sharing of equipment. This is also a big one. Or if you do have to share, you need to clean it between uses when you pass it on. And, really develop a regular and thorough cleaning regimen. So you're probably going to have to clean spaces more often, clean after a customer or an employee comes through, because that is one of the ways that we do pick it up, is through touching of objects that other customers who have COVID-19 may touch. So if you touch your nose and then you touch an object in the store and somebody comes behind you and touches that same object, they could possibly pick up COVID-19. It is less likely than if somebody's coughing in your face, but it is still certainly a way that we do pick up the disease. One of the other ways is to really identify and isolate individuals early. So have your employees self-monitor for symptoms while they're at work. They may not have a fever, they may not have a cough or cold while they're walking in that morning, but if they develop it later on in the day, just really encourage them to let you know so that you can send them home so they can isolate. And then really if they do leave at that point, you need to take special care to clean their workplace and clean any place that they may have been in contact. And really just have clear policies for your employees of what to do if they are sick or were suspected that they were exposed, and who to report to and when. And so that's one of the things, is just to make that reporting process as clear as possible. Some of the things that we have seen at Baptist with exposures and outbreaks among employees, one of the things is employees gathering in areas for lunch. We made it clear early on that you were supposed to stay 6 feet apart, respect that social distancing and wear masks, and that we really weren't supposed to eat in those communal areas. But as the months went on, people got back to their usual habits. And so we have had more of our employees have to be furloughed and sent home because they're eating in a communal area with a friend and they're having that contact, which will lead to exposure. And so that is a big one. We've had to readdress that multiple times since we've, gone to over these last 6 months. And so that is something that I would encourage you to do really early on, is really address that specific scenario and just really encourage them to eat separately and at their desks.
Thank you. So you mentioned some key measures for the prevention in the workplace. Are there any additional measures people could take beyond what you provided?
Yes, we do a few other things at Baptist. So what we do is we take everybody's temperature that comes into the hospital or just in our corporate office as well. So every morning I'll get my temperature checked. And every morning I have to fill out a questionnaire asking if I have any of those symptoms that I mentioned. And if I have any of those, then it alerts me that I need to get tested or clear with my supervisor before I can proceed to work. That is one of the main things that we do, really trying to identify and proactively get those workers to identify if they're sick early on. We do that for any patient that's coming into the hospital or any visitor coming into the hospital as well. We check their temperature. We don't necessarily ask every one of them if they're having any signs or symptoms, but there are signs posted throughout the store, not the store, but the hospital, that if you're having signs and symptoms, and we list the signs and symptoms from the CDC's website, that we ask them not to come in. We also require masks as well for everybody that's coming in. And one of the things that we had done as well is we tested all of our employees early on to make sure that they did not have COVID-19. And we've worked with several businesses in the metro area to set up testing for them. So if they would like to test their employees on a regular basis, that is something that Baptist could potentially help facilitate.
Let's talk about the mitigation of COVID-19. How can business owners plan for the prevention and mitigation, of the virus?
Yeah, so doing a lot of these things that OSHA had recommended are some of the main ways that you're going to be able to mitigate. Some places are not able to maintain those social distancing guidelines of staying over 6 feet away from somebody else. Some of the things that businesses can do is insert those visual cues into the store So you can have little X's on the floor, separating out, where to stand in line for checkout. At checkout, what I've seen and what OSHA recommends some places do is install the sneeze guards between the cashier and the customer. Or, it doesn't have to be a cashier and customer, but, these sneeze guards, which is essentially just a little plate of plexiglass that you're able to see through, where they can communicate, but then you prevent that the spread from that customer to the employee. So you're able to kind of have that visual barrier there, but you're able to see through it. And what you can then do is have the card reader on the outside, so the cashier is not having to take that credit card and use it, but the customer is able to do it from their side and prevent that potential spread. So that's one of the big things, is having those visual cues, having those guards up in place, especially between, if you're not able to maintain that 6 feet apart, you can do that between desks as well. You may have seen some of these photos of schools that have those plexiglass up between students to prevent that spread. Whatever you can do to prevent that one-on-one interaction indoors that is going to last for greater than 15 minutes. That's what the CDC is going to recommend on their website. If really anything you can do, that's how one of the main ways we catch COVID-19 is that direct contact with an individual inside, face-to-face, for greater than 15 minutes. And so thinking of ways that you can prevent that, whether it's moving that encounter outside. So a lot of restaurants, a lot of places have opened up outdoor dining. Even some schools are trying to have students outside more so than inside, just because really the virus spreads much more easily inside than outside. And so moving things to that outdoor setting can be very beneficial.
Thank you. At this time, I want to remind you all, this is a great point where you want to drop your questions in the Q&A box. So any questions you have for Dr. Lancaster at the end of the event, we're going to make sure we're able to answer those. Okay, Dr. Lancaster, when can employees that have tested positive for COVID-19 return back to work, or other viruses such as the flu?
Yes, so let's go to the next slide. So this is how the CDC, it identifies those have been exposed. So let's talk about this, and then we'll talk about what to do for those that have tested positive. So we have two different scenarios. One, you were exposed to somebody who has had COVID-19, and then two, you yourself have tested positive. And so we'll go through both of those and what the CDC recommends for each. So first, you have to determine if you've really had an exposure, and there's a lot of confusion based on this. And again, the CDC identifies an exposure as you being in personal contact with an individual with known COVID-19 in less than 6 feet apart for greater than 15 minutes. And so 15 minutes is a long time. So if you just briefly pass somebody in the hall and they tested positive for COVID-19, that's not going to count. Really, it has to be for greater than 15 minutes for it to count. But does that person have to be symptomatic at the time? No, they don't. It can be anywhere from 2 days before that person had symptoms. And if they never had symptoms, it's 2 days before they tested positive for COVID-19. So if you've been in contact with somebody for greater than 15 minutes, less than 6 feet apart, and they ended up testing positive for COVID-19, what they recommend you do is stay home for 14 days after that exposure and stay 6 feet apart from others, and to really monitor your temperature twice a day and watch for fever and call for other signs and symptoms. So that's what happens if you're exposed. Now let's move on to somebody that has actually tested positive. So an employee that has tested positive. Well, it really depends on, well, actually, let me speak about this first. So if you are in a category that the CDC identifies as a critical infrastructure worker and you were exposed to somebody, you don't necessarily have to stay home for 14 days. If you were in any of these categories, especially, and if Memphis Metro has deemed your work critical infrastructure, then you would not have to stay home for 14 days after exposure. And if you go, and here's a list of some of the workers that would fall under those categories according to the CDC. But for critical infrastructure workers, instead of staying home for 14 days, what they want you to do is return to work, wear a face mask at all times, stay 6 feet away from other workers. Now, obviously, if you do become sick, don't come in. And just monitor yourself for signs and symptoms. There have been, critical shortages of some of these critical workers, and so that's one of the reasons that the CDC makes a special exception for those employees and those workers. So let's go to the next one. If you are not a critical infrastructure worker and you test positive for COVID-19, you're going to be in that first box up top. What the CDC recommends that you do is you stay home for a minimum of 10 days after the onset of symptoms. And you should be able to return to work after that minimum of 10 days or being without fever for greater than 24 hours and symptom improvement. Your symptoms don't have to completely have gone away, but you do have to have no fever for 24 hours. And previously they were requiring you to get retested and things of that nature. That is no longer the case anymore because they're finding that patients can continue to test positive for well over 30 days, even though they're no longer infectious. So they're really only infectious for about 10 days and while they're still having that fever. So if it's been 11 days, you don't have to get retested in order to return to work. You just need to make sure that you haven't had a fever in 24 hours and it's been 10 days since your symptoms have started. Or if you're asymptomatic, if you're one of those asymptomatic cases, we do it 10 days after the test was performed. And so those are the cases of COVID-19 that have been, those are people that have been diagnosed with COVID-19. If you're a critical infrastructure worker, the same thing applies to you. I can go into what to do if somebody in your household has had COVID-19. And this is a big change for Tennessee. This came out last week, this guidance. So if you have somebody in your house, if your spouse or one of your kids gets diagnosed with COVID-19, so they have to stay at home for that 10 days. They have to self-isolate. But you also have to stay home for that 10 days because they believe that you've been exposed. But then they also want you to stay home for an additional 14 days. And the reason why is that if you could potentially have gotten COVID-19 from that household contact on day 9 or day 10. And then, so you were potentially exposed to that household contact. So now that 14 days that we discussed earlier, being home after that exposure happened, would apply to you. So again, if somebody in your household gets it, you're going to potentially be out for about 24 days after your exposure. So you have to wait that entire 10 days of isolation for them, and then an additional 14 days because you've been exposed to that household contact. Now, we did check with Tennessee Department of Health, and this does not apply to critical infrastructure workers as well. So if you go back to that, if you remember back to that original slide, you would still be able to go into work. You just need to wear a mask and monitor yourself for signs and symptoms. And so those are all the categories of workers that would fall under there. And so there is in Tennessee, I think it's a pretty broad category of workers, especially at the bottom. If you look at those that are working in contracted vendors in food, agriculture, critical manufacturing, IT, transportation, energy, and government facilities. So really check and know where your industry falls is going to be important for that and what to do with your workers. But if you go back to that last slide, there was one other category of what to do. Keep going. Next one. One more. The non-household contacts. Again, this is somebody in your store comes in and you had that greater than 15 minutes of contact and less than 6 feet, that's the last category, and you need to, again, quarantine at home for 14 days.
Great. If social distancing is not feasible, are there any measures that you recommend?
Yeah, so the measures as far as the sneeze guard and things of that nature are what you should really have in place. Remembering to try to have as much done outside as you can. And you're really trying to have those physical barriers in place. We had to do this at one point with one of our nursing homes. We had an outbreak in a nursing home way back in April. We erected some physical barriers between their beds. So we actually built a wall within the nursing home unit, separating them out. But those are for known cases of COVID. If, obviously, hopefully at your workplace, you're not dealing with known cases. But again, trying to maintain that separation, that physical barrier between the known worker who's hopefully not a COVID-19 case with the customer coming into the store that may have COVID-19, and trying to separate that out. And again, separating workers with those sneeze guards, again, that I recommended.
Thank you, Dr. Lancaster. So we're now going to go into the Q&A portion of this webinar. Thank you all who submitted their questions. For those, just in case, for those that we aren't able to answer today, we will send, a Q&A recap after this webinar to the email that you provided. So the first question is the coronavirus carried on a person's clothes or clothing?
So it theoretically can. Again, early on in the pandemic, we were very concerned about picking up COVID-19 from surfaces. And so there was a lot of work early on, and we learned a lot over the last 6 months about really how people acquire COVID-19. You may have heard of people getting packages from Amazon or other suppliers and wiping them down before they brought them into their house, wiping down the groceries and things of that nature before they left them. The CDC is no longer recommending that we do that, just because they found that you were much, much, much less likely to acquire it based on that. Now it's theoretically possible the virus does live on surfaces for a period of time, but not as long as we had thought. And so, the main way that we look to prevent it is from preventing those experiences where you're directly coughing on somebody or in contact with somebody and breathing on somebody. There's some things they call super spreader events that typically lead to exposures, large exposures. So anything that is going to require a sustained and large effort from your respiratory tract. So if you're singing, if you're in a crowded bar and having to shout, if you're really trying to, if you have an audience and you're trying to give a presentation, so if we're doing this in person and all y'all are in the audience and I was speaking, that would be, and I had COVID-19, that would be something that could potentially spread it, because what we're finding is anything that projects that voice and projects that coming from your chest, coming from your respiratory tract is really how we're exposing patients. But, it is theoretically possible, but very unlikely that, your husband or wife comes home and they work in the hospital and they have it on their scrubs and you touch it washing the clothes, that you're going to get COVID-19 that way. There haven't been any cases that I've seen that reported of that nature, not to say that it's not happened, but it's certainly not the most common way it happens.
Good to know. Is it okay not to wear a face covering when you're outdoors?
So there's also controversy around this, but it is much, much less likely that you are going to spread COVID-19, again, outdoors, passing somebody randomly walking or passing somebody randomly running past them. Theoretically possible, yes. And that is why some places around the country are advocating for this. It is not what we're doing here in Metro. But, again, that inside less than 6 feet away from somebody for 15 minutes is what we're seeing the majority of the cases come from. So I go running. I run almost every morning. I traditionally don't wear a face mask. If I was walking in a crowded area, I would potentially want to wear a face mask to reduce that exposure. But just passing one or two people on the sidewalk, I would not necessarily think that you would need to wear a face mask. Though if you wanted to maintain that 6 feet of space between each other, that would be beneficial. Now, if you're walking down the street and somebody turns and coughs directly in your face right as you pass them, that's a little bit different of a scenario, but just breathing on you, I would say it's very unlikely to develop it.
So the next question is about Lysol disinfectant. Is it safe to spray the atmosphere? Is that a good practice or not?
So I can't comment on how Lysol affects the atmosphere as far as, whether or not it's safe to, I would not want to be breathing that in directly. So sprayed away from your nose and mouth. But it is one of the EPA's products that's listed. They have greater than 500 products listed on their website for what is safe for COVID-19 and effectively kills it. So it is one of those things that are effective at killing the virus, but don't spray it just up in the air. Spray it on a surface and wipe it down. It wouldn't be something you'd want to put in your ventilation system and have running through to kill anything that might be in the air. Other ways to help the ventilation is look at your actual air filter. So this is something we forgot to talk about, or I didn't talk about it, but OSHA does recommend a certain filter for your ventilation system. So I forgot the exact name. It's like MERV 5 potentially, I think is what it is. But if you go and you're buying a new air filter, and there's usually 3 specialized categories that you'll look at. One of them, the most expensive kind always, is the one that will filter out viruses and bacteria as well. So that could be one way, again, that you could prepare your workforce, is to use those filters more regularly than the general ones. And also, you can also increase your ventilation rate, or the amount of ventilation that you do. At the hospital, we use negative pressure ventilation for all of our patients with COVID-19. So those are known cases, probably unfeasible to do in your business, but that is one way. It's just improvements in your ventilation and improvements in your air quality that can help potentially reduce the spread.
Thank you. We have one more question. So I'm going to read this one to you. I have EMTs that are partners, and they're required to drive and work together. One has tested positive for the COVID-19. What must the other partner do since he was in contact with the partner that is tested positive? How long should the other person be off or isolated? And what must they do upon returning to work? So some layers to that. So we can start at the very top. If one has tested positive, what must the other partner do?
Yeah, so that would go into that category of high risk exposure. So that, if they were tested positive and that partner was in less than 6 feet for greater than 15 minutes of the partner, while they were symptomatic or 2 days before they became symptomatic, that would be termed an exposure. A high-risk exposure in healthcare, we actually break it down, and EMTs would fall into the healthcare category. Mm-hmm. So you would have high risk, medium risk, and low risk exposure. And so we actually look at it as, was the partner wearing the appropriate PPE? Did they have a face shield on? Did they have a mask? Did they have an N95? And so there's a lot of different special circumstances related to healthcare. And the CDC also breaks that out on their website. But again, they would also fall into that critical infrastructure workforce, I believe. EMTs should. And if that's the case, then they would be able to return to work if they're wearing a mask, keeping that, and they're able to keep physically distant from their partners at work, and monitor themselves for signs and symptoms. And so that is what, based on that CDC guidance, they should do, because they're in that category of critical infrastructure workers. And that all depends on if they were truly an exposure and they were truly a high risk exposure. You know, their CDC's website does break that down a little bit more. If it's a low risk exposure, you know, you may be able to come in and just monitor your signs and symptoms. But if you really were a high risk exposure, and so sometimes in healthcare, if we have a patient that has known COVID-19 and a known episode of them coughing in your face or something like that, and that we take a little bit more seriously, and and especially if the worker that was exposed was not wearing a mask or not wearing the face shield, then we may opt to send them home for that 14-day period instead of bringing them back in and monitor for signs and symptoms. So that would be something that I would definitely check the CDC's website for and see where you fell. But again, I believe because they're a critical infrastructure worker, they would monitor for signs and symptoms.
Thank you. That's actually our last question for today. So thank you all for joining us for today's webinar. We hope you're able to take away tips that you can implement in your workplace and also into your operations. We'll be hosting similar COVID-19 related seminars each month. In September, we'll focus on telework and cybersecurity best practices. We'll also be launching our online portal called the Business Gateway, the Business Resource Gateway. This hub of COVID-19 resources is free and will be continuously updated with the latest practices and tools to help you combat the impact of the pandemic. And one more thing I want you to do, stay up to date on all things MBDA Cares. Be sure to like our page on Facebook. Just go in the search bar, type in MBDA Cares, you will find us, like the page. Keep an eye on your email for upcoming announcements about future webinars, events, and all updates on COVID-19 relief and recovery. I want to thank you again for joining us. Be safe and have a wonderful day. Thank you.